If, like me, you're an expectant mum or even a dad-to-be, then at the 20-week scan, you may well be interested to find out the sex of your baby. But depending on which area you live in, the hospital might not be willing to tell you. So, Dr. Ian Pollock, what do you think? I mean, should we be able to find out at that stage or not?
It's a good question. Some hospitals do and some hospitals don't tell people. One of the issues is the time spent doing it. The ultrasonographer, the person who does the test, sometimes finds it's a boy or a girl without really looking hard and they happen to know. But sometimes they might have to spend a little time doing it. So one question is, should we pay and spend time with our staff looking for something? Because after all, if it's a boy or a girl, isn't really a health issue.
No.
It's a nice thing to know, but it's not a serious problem. We're looking for problems and scanning to do with, does the child have a heart problem, or normal kidneys, normal brain?
Well, it's interesting you say, because the hospital I'm in for this pregnancy is different to my first child, because I've moved, and they wouldn't tell me, and it was really frustrating because you could clearly see that the sonographer knew exactly what it was, and she wasn't prepared to tell me, and it was very frustrating, especially for me in a practical sense, because lots of parents, if they're having their second child, you know, even the simple things like, I've got a bag of pink clothes at home in the loft. Can I send them to charity now, or can I, you know, do I have to hold on to them a bit longer? You
have to remember that it's not an exact science, and it will not be 100% right. Even with good ultrasonographers sometimes won't easily be able to see. It'll just be a difficult scan, so it won't always be right. So sometimes the hospital is a little bit concerned that it might get it wrong. So that's one concern. And we know in some parts of the world, probably in this country, having a girl or a boy is quite important because some families don't want to have girls and may choose not to continue a pregnancy just because it's a girl. And that's obviously a worrying thing, but probably not an issue in this country.
I mean, would if that's not such an issue in this country, perhaps, you know, the time element that's spent by a sonographer doing this work could be paid for in an extra sort of chitty amount at the end of the scan. You know, you want to find out, it will cost you a fiver.
I think that's an interesting discussion. I think most departments would like to raise more money, but obviously it shouldn't be important to have to get money from patients during the NHS consultation. It's, after all, it's free at point of service. I think maybe if people would explain that we may be able to tell you whether it's a boy or a girl, but we won't always be right. That would be one approach. But I think it's wrong to expect someone, I think the problem is looking and spending time looking when that person could be dealing with the next patient, dealing with the next mother.
Right, okay, well thanks for that.